causes your body not to produce insulin, or not to be able to use insulin, which is something it should use, and it should use very well and very properly, or very, very important. And when it doesn't, so they kind of consider that an autoimmune disease. Reduce the risk of type 1 diabetes 80% after 31 years. And it's a pretty sizable amount of people. And they did the study right. They used 2,000. I used vitamin D. So when we do the studies right, we see big results. 80% decrease in diabetes. If we had that in this country, it'd probably save our country. I couldn't tell you the billions and billions of dollars that would save us in healthcare. Yeah. I mean, that's the thing. I don't know why doctors even tell you about this stuff. It's gonna put us out of business. Not me, because I don't really do a lot of stuff. Rheumatoid arthritis, again, 44% inverse relationship with, again, only 400 IUs a day of vitamin D. If we pushed it up to 2 to 5,000. And typically with people with autoimmune disease, they want to have their levels at least 60 to 70, if not a little bit higher, because they already have a problem with function that they know of. So they might even want their levels a little bit higher. And a lot of the rheumatologists are trying to push these levels on these people to that range, because that's where they're going to be most effective. And they also inversely find a lot of times that people that, if their normal levels of vitamin D are at that level, they don't have these diseases. They just don't exist in people that have normal levels of vitamin D upwards of 50, 60, 70 nanograms per milliliter. They just don't exist in those populations. They found that just increasing your vitamin D up to around 40 nanograms reduces your risk of falls. All types of fractures combined at only 35 nanograms per milliliter. Multiple sclerosis reduced by 60% in people that are upwards of 50, and type 1 diabetes up to 80%. Chronic fatigue. If you suffer from aches and pains and tiredness and all that other stuff, a lot of times with chronic fatigue, we see it's a diagnosis of low specificity, which means there's usually a lot of stuff wrong, but nothing clinically wrong. You can't point at one thing to say that this is your problem. Well, a lot of times they don't look at vitamin D. They don't. It's not one of the things that they look at. So a lot of times, and as we found that vitamin D has an effect on a wide range of different systems, we see that a lot of times with chronic fatigue, they have a problem with a wide range of different systems. They're just not operating optimally. And so if you have 3 or 4 systems that are running below optimal levels, it's going to create a problem, and you're not going to be able to quite point your finger at where that problem is. And simply getting your vitamin D levels up will do a lot to help get those systems running properly and take care of a lot of your problems. Also with coordination of those systems too, because vitamin D does a lot with coordination and making cells function properly and function right. It'll help systems function properly with each other, because sometimes systems need another system to function properly for it to function properly, and vice versa. So vitamin D will help you with that as well. Serotonin production and uptake are major players with depression and mental disease. A big one that we see with vitamin D is the seasonal affective disorder, which affects a lot of people. And it's simply just not enough sunlight. What does sunlight do for you? Vitamin D. Serotonin, primarily made in the large and small intestine. We already talked about how vitamin D is needed for absorption of calcium. Calcium is important in the health of a lot of tissue, and also important with the health of the intestines and uptake of other nutrients from the intestines to produce a lot of these other hormones that we need. So serotonin, which is a chemical that works in the brain, is primarily made in the small and large intestines. If they're not functioning right because of low levels of vitamin D, we're going to have problems with depression, and a lot of times mental disease is tied in with that as well. Vitamin D helps improve the function of small and large intestines. Proper amounts of vitamin D important for also serotonin uptake receptors in the brain. They help things to function better, help the body to utilize what it's got better. Sometimes that's the problem. We got the parts, It's just not, you know, the key's not going in the hole, not flipping the switch. Also sleep. We see a problem with sleep in depression and mental disease. Adequate amount of sleep can play a role in depression and mental disease. Vitamin D aids in the production of melatonin and also the production of uptake of melatonin in the brain. Melatonin is the primary hormone associated with sleep and stimulating sleep cycles. Pregnant women and breastfeeding mothers. About 80% of pregnant women are vitamin D deficient. Severely deficient, which means they're below 20 nanograms per milliliter. They should be around 50 or 60 or 70, which means their child in utero is thus deficient. Mom does none, baby's got it. These women continue to be deficient while breastfeeding. They used to think that breast milk was a great source of vitamin D. But if mom has no vitamin D in her system, how can the baby have any vitamin D? In fact, she put any vitamin D in his milk. You know, it's just kind of a supply and demand type situation or scenario. So they're recommending for mothers to or pregnant women or breastfeeding mothers to supplement between 2,000 and 5,000 IUs a day, especially if you live up north, you're not getting that sun. To reiterate some of the facts that we've talked about, if you live higher than 30 degrees latitude, which is around Atlanta, Georgia, it's a good idea to have your blood levels checked and tested so you can know exactly how much to supplement. But it's, for anyone that lives around here, I guarantee you're not going to have, you know, more than 40. You're probably, if you're lucky, you're in the 25 to 30 range. You can easily take 2,000 to 3,000 units a day, probably way more than that. I personally usually take anywhere between 2,000 and 10,000 units a day, depending on how I feel that day. And it'd be perfectly safe for you, especially, you know, anyone can take at least 2,000 units a day, and it'd be perfectly safe to take that to help get your levels up a little bit. If you really want to, you know, if you have a problem that you think may be related to that, get your blood levels checked, you know, and then you can really start to work on how much to take. You know, we can kind of zero in on it a little easy. Another interesting fact is we've been decreasing our sunlight exposure over the last 100 years. We've been moving indoors, living indoors, working indoors. We've also, in the 1980s, we saw we started to see this big thing about, they started to kind of demonize the sun. It's bad, you know, start wearing sunblock in the sun. Sunblock, even at low levels, SPF 8, SPF 15, is effective in blocking 99% of UVB rays. So I mean, once you put sunblock on, you've now got almost zero UVB rays and you're producing almost zero vitamin D. And another thing, don't forget all the toxic stuff that may be in the sunscreen. What's the chemicals in there that are leaching into your skin that you just put on yourself? You know, so they may also, not only have you blocked one of the best chemicals to decrease your risk of cancer, you just put chemicals on your skin that may increase your risk of cancer. For every one death for sun overexposure, there's around 200 from other types related to vitamin D deficiency. So it's definitely a better idea to be in the sun than to not be in the sun, or to get your sun. Other things that are, you know, other conditions that are associated have benefits for vitamin D, psoriasis and eczema. These two things are very closely related to, if you have any of these, with intestinal problems. If you have, you know, blockages in your intestine, problem with nutrient uptake from your intestine, a lot of times these can show in skin problems, and sometimes getting your intestines healthy will clear up the skin problems. There's a strong correlation between the two. Vitamin D definitely helps to increase your body's health in the intestinal area, and then thus will help with skin problems, especially psoriasis, eczema, acne, another one. Hearing loss, calcium, real responsible for, or works real important with nerve conduction. Hearing is a form of nerve conduction. If you don't have enough calcium, nerve conduction is not going to happen.
If you have hearing loss, can it be reversed?
Depends. If it's just the nerve not functioning properly, maybe. If it's actual damage in the tissues that sense sound, that may not be reversed. But sometimes it's just conduction from, if the signal's not getting to the brain, that may help. Muscle pain, again, calcium, real important in muscle function. Not enough calcium or too much calcium can